My topic for today is electronic health records. It's a very pertinent topic because it's a step towards modernization of the hospitals. Most of the hospitals have either adopted the system or are moving towards it. So first of all, hospital management system, which is components of managing this is a system by which you can electronically manage various components of the hospital, like operational components, which include patient registration, scheduling of various procedures, etc. Then workflow management. Financial component is billing and inventory management. Then there is clinical data, for which clinical records through hospital management software are called electronic health records. Introducing electronic health records to you, it signifies an electronic version of paper medical records of the patient. These are stored in a digital format and are real time with instant access, getting updated at all the sources and locations at which it is being created. As a new value gets entered, deleted or altered, it gets updated at all locations. And it's a comprehensive tool with past and present medical records of physical and mental health of an individual in electronic form. These empower patients by providing them with easier access to their health records, making them more involved in their own care, and also allow patients to communicate with their health professionals. Electronic medical records, it seems similar to electronic health records, but it is different. And this includes patient contact information, physician orders, allergies, insurance, billing information, surgical notes on medical progress and prescription, vital signs of the patient, BMI, medical facility appointments, past and future, treatment plans, and discharge summaries of the patient at a single clinic or single practice. Now, to differentiate the two very clearly, once again, I'll differentiate through this table. Electronic medical records provides digital patient charts for a single practice, whereas EHR allows physicians to share records with other healthcare providers regardless of location. EMR is a narrower view of patient's medical history, whereas EHR has more tools and features to provide a broader snapshot of patient's medical history. EMR allows entry of patient's medical care, including test results and prescription. EHR gives additional communication features, allowing healthcare providers from different institutions to collaborate on patient care. EMR gives information here. Information is not designed to be shared outside the clinic, whereas in EHR, information may travel to different specialists, labs, imaging facilities, and more, regardless of location and across the states as part of the EHR. Components of electronic health records, again, we have administrative details like registration information like name, address, contact number, patient demographics, next of kin, employer information, Aadhaar number, or any unique ID of the patient. Then we have admission details, patient admitted in which specialty, under whom, diagnosis of the patient, then inpatient records, discharge information, and transfer details of the patient. Clinical details, computerized physician order entry regarding detailed information about diagnosis and current treatment plans. We have nursing orders, flow sheets and medical charts, informed consents, perioperative notes, and discharge summaries. Laboratory details, which include reports of various lab tests ordered by the physician. Radiology details, reports and images of various radiological tests ordered by the physician, usually used in conjunction with PACS, which is a picture archiving communication system and is an important component of electronic health records. Then we have pharmacy details like medication history and current medical plan of the patient. Components of electronic health records, as has been discussed. This slide is again explaining the concept of electronic health records to you. In a very lucid manner. We have various features being presented on this slide, like communication, we have customized templates, payment management, task management, reminders. These are almost the administrative components. And then we have, charting and lab analytics, patient portal for assessing his own records. Then we have patient record management, e-prescribing, and medical history of the patient, all as component of the electronic health records. PACS, this is, I've already discussed, picture archiving and communication system. Diagnostic and radiological images from various devices are captured and integrated, stored and disseminated to medical records, clinical data repository, and other points of care. We have various tools in electronic health records. These are info buttons, computerized provider order entry, clinical decision support or clinical decision support system, CDSS, personal health record, and clinical data repository. Coming one by one, info buttons, these info buttons context specific link. These are context specific links from one information system to another resource. Then these provide relevant contextual information, and these are various needs at a point of care. CPOE is computerized physician order entry. This allows provider orders to be written electronically in a hospital, both inpatient or outpatient settings. This eliminates handwriting misinterpretations, which is very important, sometimes a very important source of error. Then CDSS, clinical decision support, provides intelligently filtered clinical knowledge and patient-related information. Then we have both these CPOE and CDS often work in tandem to ensure appropriate patient treatment. And by this manner, we can improve patient care through electronic health records. CDR or clinical data repository, this is a database that stores all the health information of EHR. Various advantages of electronic health records, general benefits like improved data integrity. These are readable, better organized, accurate, and complete records. Then improved productivity. We can access data anytime, anywhere for timely decision. Otherwise, one keeps searching various papers. Then this increases the quality of care. We have tailored views, dashboard, intuitive formatting, and enhanced interaction. Each document is stored with date and time. Then this gives increased satisfaction to caregivers, and there is easy access to client data and related services. Various disadvantages of CDSS: expensive setup, difficulty in content and system maintenance. Users may not agree with the guidelines provided by CDSS. Inaccurate and poor quality data aggregation could be there. Too many insignificant alerts and recommendations. These may cause alert fatigue. Then there is a negative impact on user skills also. Sometimes we are too dependent on these electronic things. Various standards of electronic health records. Ministry of Health and Family Welfare notified the electronic health record standards for India in September 2013. Standards herein were chosen from the best available and used standards applicable to electronic health records globally as could suitably be applied in India. Then EHR standards further were revised based on recommendations of expert committee in 2016. Then CCHIT, this term is important, Certification Commission for Health Information Technology. This is a certification body endorsed to evaluate EHRs for adherence to standards. And then HL7, which is also full form is a Health Level 7. This is a series of standards designed to allow data exchange and interoperability of EHR. DICOM, this is digital imaging and communications in medicine. Medical syntax used to exchange medical images between medical equipment and information systems. This is centered on medical imaging. This is a vital feature of EHR, readable data. We have dependent on adherence to standards. So if the standards are adhered only, then EHR serves us the best. And Ayushman Bharat Digital Mission, this is most latest. Prime Minister Shri Narendra Modi launched the Ayushman Bharat Digital Mission on 27 September 2021. It will enable every Indian citizen to voluntarily generate a unique health ID that will contain their medical history and records in a longitudinal manner. Aims of the plan are to enable easy access to electronic health records, to generate health record data, to ensure privacy of personal health data along with consent-based access to electronic health records. Benefit to patients. This is the availability of health data at a single click of mouse with consent for the patient. Then there is improved efficiency, effectiveness, and transparency of health service delivery. Data storage security and easy access to medical records by healthcare providers to ensure adequate treatment and follow-up. Transparency in pricing of services, then there is accountability, digitalization of health insurance and faster reimbursement processes. All these are very beneficial to the patients. Now, again, summarizing the advantages of EHR, though it could be repetition of certain points, general benefit, again, I'll say improved data integrity, productivity, and improved patient care and satisfaction. Nursing benefits, there is decreased redundant data collection, provision for updating records at bedside, improved documentation. For healthcare provider benefits, we have faster data access, improved documentation, timely administration of treatment and medications, early warning of status changes, patients with COVID symptoms marked separately in software to avoid any physical interaction. Healthcare enterprise benefits. These are the benefits for the hospital, like better record security, instant notice of eligibility or procedure authorization, decreased need and cost of record storage, decreased length of stay due to waiting. Patient benefits include digitally accessible quick patient transfers, avoids miscommunication, increased access or control over healthcare information. Community benefits, very important, better understanding of underlying issues in public health, improved healthcare policy decisions, and improved personal and public health. Disadvantages of electronic health records. Definitely, we have certain disadvantages like high cost of computers, software purchase, and maintenance. Then we have to depend on reliable operators. Staff training is very often required. Then medical legal risks and barriers are there. Despite layers of security, electronic records are prone to leakage, so the privacy could get, hampered. There are factors for slow acceptance of EHR. We are talking about the good points of EHR, but the institutions and hospitals are slow in adopting. Why? There is a loss of revenue. There's a lot of expense involved in changing from paper records to electronic health records. Then we have local versus global perspective. Then security problems are there. Learning curve for all the physicians, nurses, and the other people. Overconfidence in personal physician skill, which hinders us from sharing with others. And this is a tickler file. I thought it is very important to include this. Tickler's memory. This is a way to remind oneself in future. Tickler file software arranges your e-file systematically and chronologically according to future date when action needs to be taken. Any lab work or procedure ordered by a physician are recorded electronically as a tickler. Then the advantages are many, like time management allows to check multiple activities in one spot, track of due dates and important dates, sent as email reminder directly on smartphones. Immediate availability of data is there without sifting through a stack of papers. Then sharing of ticklers with team members makes the teamwork more pertinent. Then these are my references. Thank you very much for your time.
Really, very simply put, a very difficult topic, Dr. MD Kaur. I'm so happy. And I think the government is, I think, very fast in doing it. And we should help because we are the people who can really help them. And health ID cards, I think, and I will make it today. I resolved to do it today. And let's pledge that everyone will do it. And definitely it improves the quality and the outcome and helps the user as well as the administration. So really good. Thank you so much. Thanks a lot.